Hello, everyone, and welcome to this edition of Let's Talk, presented by the Visiting Nurse in Hospice for Vermont and New Hampshire. I am your host, Anthony Knox, the Community Relations Manager for the VNH, and today we're here to talk about the Ottauquechee Health Foundation. I have our Grants Manager, Beth Robinson, here to be able to provide some information and understanding about what OHF is. And as well as that, later in the presentation, we're going to be talking to Anna Lewis, who is someone who has benefited from supports from OHF. If you are watching this presentation live and in person, feel free to drop some comments or questions into the chat box there on YouTube, and we'll be able to answer them in real time. For anybody who is watching this recording later on YouTube, feel free to reach out to either myself at the VNH or Beth Robinson at OHF, and we'll be able to answer any questions that you have. At this time, I want to officially introduce Beth Robinson, who you see there on the screen. Beth, please, introduce yourself. Provide us with a little bit of your background, and we'll go from there.
Hi, good morning. Thank you, Anthony. Hello, everyone. I was familiar with the Ottauquechee Health Foundation for many years, but from a different vantage point. I worked in a private dental practice, and so I saw the workings of the Ottauquechee Health Foundation as the provider would discount services and see folks that the Ottauquechee Health Foundation would send our way. And so I knew the woman who was doing my job at the time, and I knew that what the providers were doing. I knew what that paperwork looked like. I knew what the system looked like. Loved the organization. And when my children got a little older and I was able to have some time to do grown-up things, I actually got on the board at the Ottauquechee Health Foundation in 2014. Sadly, I was only a board member for a couple of months. My husband was diagnosed with cancer, and I knew, my commitments, I couldn't hold that commitment. So I stepped down from the board and found myself in a situation with a terminal illness and struggling financially myself, and reached out to the ED at the time and the Grants Coordinator for financial assistance, as I managed a household on one income, and my insurance fell short on certain things. And they were kind and caring and wonderful individuals, and I wouldn't have been able to do it without them. And sadly, my husband passed away in December of 2015, and I found myself in the office at the Ottauquechee Health Foundation. I wanted to thank them for everything that they had done for me, and had chosen not to go back to my previous job, and didn't really know what I was going to do. And the ED at the time looked at me and she said, "Our Grants Coordinator told me today, she gave me your notice. Would you like a job?" And so I started very, very part-time, trouble kind of getting back into the real world, the work world. And then, so I've been here almost 7 years now. So, so grateful to know the organization from lots of different angles and vantage points. So that's my story.
Wow, that's an awesome story, and right place, right time, and the right individual for the role. For anybody watching this who doesn't know me or anything like that, so I used to be the practice manager at the Ottauquechee Health Center, which is right next door to the Ottauquechee Health Foundation in Woodstock, Vermont. And so I've known Beth for many years now, and personally, feel that she is by far and away the right person to be within this role, and just the passion for wanting to support the community that OHF supports, and which we'll get into, and just kind of understanding more about what they've done. They found a diamond in the rough for sure in relation to this role. So with that, let's dive into this presentation, just kind of talking about what OHF is. And again, for anybody watching, please ask questions as we go. And Beth, I'm gonna hand it over to you.
So the first slide, thanks to our communications committee, is our new logo. We get confused a lot with the Ottauquechee Health Center, and although we partner with the Ottauquechee Health Center on a lot of things, a lot of patients, a lot of our applicants, confusion in terms of what we do and what they do. So they have providers and we have grant funding. We're calling ourselves OHF, and the logo is wonderful.
Yeah.
Okay, so and we'll move along the slides here. So a summary of our mission statement. The Ottauquechee Health Foundation improves the health and well-being of people in need who live in the towns we serve. We do this through financial assistance, community partnerships, educational opportunities, and support of wellness initiatives. We assist in the healthcare needs of the core towns, so Barnard, Bridgewater, Heartland, Killington, Plymouth, Pomfret, Quechee, and Woodstock. Reading and Woodstock. Oh, here's me and my dog Chance. Yes, he's an office dog and friendly. Sometimes folks are having a rough time, and pre-COVID they'd come in to let me know what it was we could help them with, and I would often see them sitting petting my dog. So yeah, he's part of the furniture. He's part of the furniture here.
And he is the most friendliest dog you will ever meet. And always willing to just come over and just wants a couple pets. That's all.
Yeah. Folks often, older folks or folks who have come into different living situations often say, "Oh, I miss having a dog," or "Oh, it's so nice that he's here," and they bring him presents and treats, and yeah, he's kind of king of the hill. This next slide describes what we do. So we offer financial assistance on behalf of individuals who are unable to pay the high cost of health and wellness services. So anything from eyeglasses, dental work, when folks' insurance, they've got co-pays on something like physical therapy. And we have really generous providers who discount services. So, too many providers to list, but audiologists with the cost of hearing aids, and even supply companies like Keene Medical and the Ottauquechee Pharmacy, discounting those services and helping us out so that our funding goes further. So we also have supported programs like Veggie Van Go with protein, so money that they spend towards a protein item that goes in with the vegetables, just to make the donation that's coming from the Vermont Food Bank more of a meal than just vegetables. Silly things like toilet paper and hand sanitizer throughout the pandemic for a Woodstock Community Food Shelf. And interestingly enough, a partnership with UVM for a safety measure for children needing bike helmets. So partnerships with Mount Ascutney Hospital. It's amazing. The list of folks we work with and for, is really long, and it's wonderful. We also have worked with Mount Ascutney Hospital and some other organizations, such as Senior Solutions, with insurance and education workshops, mental health awareness through film screenings, and opportunities like Sharing the Warmth, where folks were knitting items and we were giving them away to folks who could use the warm hand knit items, gave folks in the community something to do with their free time, and then they knew they were giving back because they had these items to give away, and they were warmly welcomed. Coat drives and Christmas trees. It was a partnership with the Rotary. It's just, so we do the health and wellness grants. But the thing that makes this job, I believe, or I feel most wonderful, the most wonderful thing about it is the respect and the support I have from our board and from my executive director. I will come up with an idea if an event happens, an accident, a fire, a pandemic, a flood. The first words that come into my head are, what can I do? What can OHF do? And so, you try to find a health and wellness spin, and most likely you can, you really can. I spend probably about 30% of my time as a resource to our communities. And my mantra is, if I don't know the answer, I'm going to find someone who does. And I really enjoy that aspect of my job here at Ottauquechee Health Foundation as well. So, yeah. So, okay, on to the next slide.
So, and just,
unless you have a question.
Well, just real quick, just to clarify also, just for anybody who doesn't know. So Beth had mentioned Mount Escutney Hospital a lot, and I just want to make sure people understand that the Ottauquechee Health Center falls under Mount Escutney Hospital. So I know there's a lot of partnership that happens with the Ottauquechee Health Center as well as Mount Escutney Hospital, but that's all one. That's all one big family there. So just, for anybody who doesn't know that they're one family.
Okay. So let's see. We also have been involved, a little less of my role, but I'm very familiar with some programs that we support schools, teachers, students, and the parents in our catchment area, not only through the pandemic, but for needs within the school system, things that are not in the budget, or potentially programs, especially geared towards mental health and mindfulness and trauma-informed resources for folks. So that's another sort of aspect of the Ottauquechee Health Foundation. Okay, I guess I've touched on all of those. So this is a little bit of numbers. We can kind of go through this. The thing that I'm most proud of are not only the individual grants, as you can see, from 2019, 20, 21, and 22, the amount of funding approved has gone up. Number of grants looks slightly down, but if you look at the average cost per grant individual, in 2019, it was about $600 per grant. We're looking at double that now in 2022. So you can see the costs of health and wellness, not that it's doubled on every aspect, but it's certainly gotten much more expensive for folks. And then listed below, the community grants, Heartland Food Shelf needed a new ramp to get into the food shelf to access, so more people had access. The the Woodstock program for the Veggie Van Go. We collaborated with the Thompson Senior Center with our caregiver registry. So they have the caregivers that are looking for employment. And then we have respite grant funding through the Ottauquechee Health Foundation. And we helped build a new safe swing set gymnasium type obstacle course for the Killington Elementary School. We helped fund that as well. And I think I already mentioned the bike slides and the bike helmets and the masks and the other things.
So Beth, real quick. So
go back.
So you've talked about the grants and some of the things that they've gone towards and things like that. How do people that aren't a part of some of these organizations and things like that get connected to you in to get the support that they may need? I know you had mentioned working with individuals to help them with hearing aids and things like that. So I guess what is the typical way that somebody may show up on OHF's doorstep as far as needing support?
So sometimes it's their primary care physician or a social worker or a nurse doing a discharge plan. Sometimes it's a neighbor or a family member. What I really like to hear is that someone will call and they'll say, this person said, call Beth. And so what I try to let folks know, especially if it's difficult to kind of have an understanding of what we do, there's never the wrong question. So call and ask me, what it is we support with our funding. Sometimes it's as simple as someone might call and say, I'm really having difficulty paying my rent. And I might say, well, we don't have grant funding for rent. but here are maybe some resources who could help you with that. But is there something that's health and wellness related that we could potentially help you with so that you have that money to put towards your rent? So there's a couple of different ways to look at it. So, I'm trying to be out in the community, at the food shelves at Veggie Van Go. I'm actually partnering with the Upper Valley Haven right now and working at registration because of the numbers of folks from our catchment area that actually utilize the services there. And just a lot of word of mouth. And that's the lovely thing about the small communities. They all have either a food shelf or a church or some way that's the word gets out, to give Beth a call, the Ottauquechee Health Foundation. Did that answer your question?
Yeah, that's perfect. I mean, it seems as though that there's multiple avenues that people can go down as far as connecting with OHF to figure out what the support is, and so within your scope of support that you can provide, obviously there are probably some situations where unfortunately you're not able to provide any sort of financial assistance and things like that. But what can people expect from you and OHF in the event that may not necessarily be within the scope of supports that OHF provides, and kind of where do you take it from there, or where do you send somebody who may need that support still?
Sometimes, so the grants are income based. So we have a formula that we use. We look at the poverty level it's the state of Vermont, but it's across the board. And we go to 300%. So we feel like we're pretty generous. A lot of the state grants and funding that's out there, a lot of the population we work with are sort of between being able to get quite a bit and not being able to get anything at all. There have been occasions where someone's just slightly over that amount, where I've gone to my grants committee, and we meet monthly, and I've said, this is the scenario, and this is what they're looking at. Potentially they haven't asked us before. This is a circumstance, and often we can talk as a committee and dig a little deeper and find the funding. Sometimes I'm sending them or giving them information about the local churches and the folks that I know there. There's another organization called the King's Daughters. There's the Faulkner Fund. There's other funding available. I have other applications here. Many of the towns have their own sort of neighbor helping neighbor. So that's all information that I have here that I like to have at my fingertips. Sometimes it's financial aid through Mount Scottney Hospital. Sometimes it's some grant funding they have. Sometimes it's referring them to Senior Solutions to see what sort of grant funding they have if they and often for folks, even if they call from out of the catchment area, often it's just nice that someone answered the phone and even had an idea of someone that might help them. Even if it doesn't pan out, they're just so grateful that they weren't left on hold and they got a real person and someone said, have you considered trying this? So again, did I answer your question?
Yeah, no. And so I think, my interpretation is that whether or not the Ottauquechee Health Foundation is going to be able to provide, any sort of financial support, there's just a wide variety of additional supports and services that you can help connect people to get the support that they need.
Mm-hmm. So, something as simple as I talk to the providers, I talk to the dental offices and the optometrists and Dartmouth Hitchcock and anyone that I can, and say, if something comes to you and you present something that they need, you can just quietly say, do you know about the Ottauquechee Health Foundation? Call Beth. And so, so there's that partnership there too. They want to provide the treatment. This is someone that, they know, a patient of record who's struggling to have, something done, eyeglasses replaced or whatever it is. And so, getting the word out there. So the providers are actually sending, folks our way as well, which is really lovely.
Awesome. Perfect. That answers all my questions so far.
Okay, on to the next. Okay, so this shows the 9 towns we support, and something that I'm very proud of, and it doesn't happen often, but we have grants in place for folks in all 9 of our towns. Part of it is that some of the towns are a little more isolated than others. So there's a little less maybe community gathering in a town like Plymouth that's so small that no longer has their elementary school. So I'm thrilled when these towns know about us and send folks our way. I had a gentleman come to me, really low income, really needed, really poor hearing, really needs hearing aids. And it was the town clerk who sent him my way because she remembered that I had spoken at their town meeting last March, and didn't really know if he qualified, didn't really know all that much about us, but she gave him my name and number, and we're working with him now. So those are the sorts of relationships and community efforts that are just wonderful. We're looking out for each other, and I just get to be the one who says, yes, we can do this. But the thanks go to, our donors, our board, volunteers, the community members who are keeping their eyes open for their neighbors. Really, it takes a village. So
That's awesome.
Thanks. Okay. And then this is granting by need. And most people aren't surprised the high number of dental grant requests. I think we're one of the few organizations.
I'm surprised just that it's 42%. Definitely dental is such a tough thing for everybody. If you don't have dental insurance or, what is or isn't covered and things like that, but almost half is, wow.
Yeah, that number is actually slightly lower than it's been. It's usually above 50, just above 50, with all the others kind of falling underneath. The one that I'm most proud of right now, not that they're all not wonderful, but are the aging in place grants, which we can get very creative with. We have folks who apply, they qualify for grant funding. Their primary care physician says, yes, this person could use these over-the-counter, I'll give you an example, over-the-counter meds, bandages, vitamins. They can't afford them. They're living on a very fixed income. And so we put, aging in place. We want to keep them healthy. They want to stay home. And so that's a way to do that. Similar to the respite grants, where someone has an injury or an accident or becomes ill, family members are struggling. So we do sort of a stopgap type of grant where folks can apply for a caregiver to come in and be with that person and provide some of the needs that the family members potentially cannot, or family members can't do 24/7 as they figure out what the next steps are. So they're not meant to be long term, but something to certainly get folks by.
And is the respite funding, is it more just for, as an accident happened and just needing some additional support? Are there respite funds for like hospice respite? Kind of what falls under that respite category?
So it's an ongoing conversation. Initially, it was just for that short term. But as we work with Senior Solutions and we see the number of folks who want to age at home and how that works for everyone, we have sort of moved from that to, let's say somebody falls, breaks a hip. At first, they've got the VNH, potentially PT, OT coming to them. They might need a little more help, but then maybe they can't do certain things. Maybe they're, showering or errands or things like that. So we've sort of put in sort of that factor where this person still needs to get strong. This person still cannot do these things on their own. And so we can put a grant. So it's not necessarily a respite grant. It's more of a spin on aging in place, aging at home. If that makes sense.
Yep. No,
Yes,
that makes
yes to the others.
That makes perfect sense. And so from so obviously, this chart is broken down into, very specific categories. From your experience, how much, if any, is there kind of overlap in the granting funds for individuals? For example, maybe somebody needs, dental and mental health supports, or they need aging in place with some vision, or something like that. So are there overlaps as far as when people are receiving grant funding?
Oh, absolutely. Often when I meet with folks, if they have one need, chances are there's something else, or maybe another family member that also has something going on. And so I want to, I like to let folks know, just because you came in and we helped with that dental work you need, go ahead and apply again. To help you with the eyeglasses or the hearing aids or what have you. We do have, we have limited funds. The beautiful thing about our providers is they do discount the services, so the funds can go further. But I just encourage people, to keep asking. And if it gets to a point where we're into December and the funding is such that, I might say, you know what, I'd like to really be able to help you, but we might just have to wait till after the first of the year.
Then for grant funding and things like that. So if someone is specifically coming to you for, I need to have a tooth removed, and I need some help with some grant funding related to dental, is there kind of like a process for asking some follow-up questions, some additional questions to determine if the individual may qualify for some additional grant funding, or is it more, it has to be precipitated by them starting the conversation that, oh yeah, I also, my eyesight's terrible. I could also use some glasses and things like that kind of. So I guess kind of take me through a process of someone showing up and needing support, and what you guys do.
Okay. So I'll either get a request for an application, or I'll find an application that's arrived in the mail. It includes their financial situation. So something showing total household size and total household income, so that I could see where they fit in terms of within our guidelines for grant funding. And the other and then we need to know that they live in our catchment area. So that's usually our first question. And then the first thing that I do, in my responsibility to the organization, is that I need to make sure that any other resources this person has available to them are exhausted first. So, for example, they indicate that they're on Green Mountain Care or Vermont Medicaid, and I know they have $1,000 dental benefit. But let's say you can't find a Medicaid provider taking any new patients, or it's an elderly person and the only option I have is further than they feel comfortable driving. So then we can sort of work around that. So, I've been known to try to find providers for folks. I'm not doing it. It's not necessarily what I do, but I will give them some ideas of some practices that may be taking new patients without showing any favoritism. Certainly if it's going to take their insurance, then, that would be enough. And then once we've established that, and once they've had the grant and they've had their dental work done, potentially, I might say to them, is there anything else that we can help you with? Is there anything else? These are some other things that we could help you with. Sometimes that's a conversation earlier on where they might say, oh, and I need glasses, and oh yeah, I should have my hearing tested. I say, let's take care of whatever's worst first. Like what's pressing? What do you need to take, what do we need to do to start that avenue of you feeling healthy and well? So
Perfect. So it's a combination of, obviously what is available already, what is, I don't want to say owed to the person, but what they should have already been able
Mm-hmm.
to access from, based on their insurance
Mm-hmm.
or other avenues and things like that. And then it's, ensuring, as much that can be taken care of, for that individual, or help
Mm-hmm.
support that individual as that happening.
Yeah, and something like, somebody may come in and need something and they do not have insurance. So we may approve a grant to take care of a procedure that they need to have, with the understanding that we will work with you and we will point you in the right direction because, this is something you need to do. You would qualify for probably some sort of subsidies. So get insurance, and then you can come back to us if your insurance falls short of things you need. But sort of put that responsibility on them. And the other thing that we find to be really something that folks, it's a feel good for everybody. We always ask the applicant to contribute something, and I can use that same formula based on their income and household size, a certain percentage. It can be anywhere from 1 to 50% of what they're asking for. They should, that's what we ask them to contribute. And so they buy in, they keep their appointments. Providers know that Ottauquechee Health Foundation, with a letter of agreement, is going to pay the rest. And the providers also let folks make payments and not charge them interest, which is almost unheard of. But because of, the understanding and the relationship they have with the Ottauquechee Health Foundation, that's another really nice thing for our applicants.
Awesome. So with that, I'm going to drop out of this presentation here, and so we're actually going to speak to somebody who has worked with the Ottauquechee Health Foundation. So, Beth, I'm going to have you introduce, and as we bring Anna into the feed. So, Beth, please introduce Anna.
So I'd like to introduce Anna Lewis. Anna was born and raised in Vermont, lived here her whole life, raised her children here. Her children are raising her grandchildren here. She's very active in her community, always willing to lend a helping hand. Someone I'm really proud to say, one of my best friends in the whole wide world, and we share a birthday. But what I would like her to do is share her story in her own words.
Yeah. So first off, Anna, thank you so much for being a part of this presentation about the Ottauquechee Health Foundation and to talk about your story. I am going to bring back up the slides that we have related to Anna and her journey. But Anna, please, talk about what brought you to the Ottauquechee Health Foundation, the trials and tribulations that you had gone through, and just as much information as you want to provide related to that, and then we'll dive into more of the story of the supports you received from OHF.
Hi, thank you very much, Anthony and Beth. So I had known about the Ottauquechee Health Foundation, but not really what they did or anything. And in April 2nd of 2020, I was in a major head-on collision 5 minutes from my home. And I ended up, they needed the jaws of life to get me out. And I had 2 broken legs. My foot was according to the doctor, a typical Liz Frank fracture with my right foot from when I pressed on the brake. Basically, all the bones in my foot broke, and it was, I guess, aiming that way to the right when they got it out. I didn't know. All I knew when I came to was there was a bright light, and I saw no color, and I thought, okay, I'm dead. but something really hurts. Not supposed to be like that, I thought. So, and then color came back, and my foot hurt and my knee hurt from the dash coming back. But I had also, the airbag had taken the flesh from my thumb to the bone when it came back off the steering wheel, because I was gripping the steering wheel when I braked, and it threw my left hand into the passenger window, which shattered, and I had glass through my hand, which I didn't know, and a brain bleed, which I didn't know, and broken collarbone and 3 ribs. So right foot, ankle, 2 legs, whatever. They got the jaws of life. The Woodstock Fire Department and the ambulance crew were awesome. And they got me out with the jaws of life after my husband and my, who's a dairy farmer, a local dairy farmer, and my son at the time, literally I was 5 minutes from home, and the farm is, a minute from home. So they were there very quickly and tried to get me out, but couldn't. And so after going to Dartmouth and not knowing, really what was going on, they couldn't come see me because of COVID. So they had to wait. My daughter and my husband waited outside in the parking lot all night until they were finally told that they're not going to be able to come in, and that I was alive. They went home, and I thought, now this is going to be hard. Okay. So I spent 11 days in the hospital by myself during COVID, which was really tough. Dartmouth did provide a care person, I guess. I'm not sure exactly what that's called, but someone that oversaw my case, sorry. And she tried, I guess, to be helpful, but it wasn't, she doesn't know me and didn't know my family and our situation. And Beth is a longtime friend. And I don't know how the initial contact was made, but between her and my daughter, Heather, they got together, and Beth was my spokesperson with Dartmouth. From them wanting to send me to at first a nursing home, which none of us wanted because of COVID, and I was compromised. My lung capacity was compromised. So she ended up facilitating first Heather being able to come see me, which I think happened at like 8 days maybe in. Before or 8 or 10 days in, right before they sent me home, so she could see how I needed to move and how to use a bedpan and how I used a slide board to get from one spot to the next when I was finally able to do this. In this picture in the slide was the first time I think that I was out of the hospital bed, and they moved me in the sling to the window, which was awesome, except for those of you who have been in a major accident. It's really hard not to be able to move yourself and wait for somebody to come. Anyway, it was very alone and a lot of despair. But Beth made it easier. She, I believe, arranged for my slide board when I was at the hospital. And when they finally decided, they kept saying, we're going to send you home, we're going to send you home. And I kept asking, well, who's going to take care of me when I get home? And they said, well, you're going to have to tell your family what to do. And I'm like, okay. How do you roll me? Where do you put I don't know where to put any of this stuff. So Beth arranged for Heather to be able to come in. I had one family member, and she came in, and it was like Christmas. It was wonderful. And so the day came, they sent me home. She arranged for my hospital bed, and I had a wheelchair. My friends and family, my husband had rushed around to build a ramp so I could get into my home. Our home was not handicapped accessible, and neither was my bathroom. So we had friends and family that rushed to try to make that happen. 44 days later, I got my first shower. And my son had to tow the ambulance up because I didn't have a driveway. So he towed the ambulance up so I could get in off our deck into the living room. And the people that were there, our friends that were helping with the plumbing, Rob Tracy and carpentry, Dwight Doughton, were, they ran to help carry the stretcher to get me inside. And and Adam towed it up so I could get inside. And Beth was there when I got there, and it was really nice to see everybody. But without the Ottauquechee Health Foundation's help, when we were reeling, so that was a lifeline thrown to us when we needed it. And for those of you that go through anything, major or not major, it's really important to reach out, because, it's 3 summers later, I'm going into 2.5 years since the accident. And after many surgeries and a lot of physical therapy, I'm still here, and I'm sorry I'm such a mess. I thought I could do this easily. Not easy.
Anna, first off, just amazing story of, that you are here, and that you are thriving, and that you're doing well, and things are working for you. Obviously, 2.5 years later, and you can actually talk about this and have a positive spin, to everything related to this is just awesome, beyond anything else. I do want, I know you had said that you weren't 100% sure how, Beth was first contacted, and how OHF kind of, came into the picture to begin with. So, Beth, if you're able to kind of provide some of those details to just kind of explain, how OHF did, finally get involved and be able to assist, Anna and her family, with, starting this long process.
Certainly. So of course we're friends. So word was out about the accident. And I think I said this earlier, personally, a friend or a neighbor, anyone, what can I do? What can OHF do? And so there wasn't a lot we could do initially, because she was in the hospital and we weren't really sure where she was going. And so I knew the insurance was really weird about certain things, like that slide board. Like, why was it not covered? I mean, she couldn't go home without that. It was a prescription. It's like, that's ridiculous. Of course, we'll start with that. She needs that. And then we found out that, the insurance would only pay for this sort of hospital bed. I'm like, she's going to be in it for a really long time. We're going to put a grant together so she gets the one she needs, that she's going to be in, that she can maneuver, that people can maneuver around her. There was something ridiculous about the wheelchair and why the insurance wouldn't cover it, because she didn't weigh enough for the size of the wheelchair that the doctor wanted her to have, the surgeon, so that she could shift on the board.
Right.
So because she weighed too much, she couldn't get the wheelchair that the doctor prescribed for her. So again, too bad. We'll grant together and we'll supplement that. Keene Medical was amazing. The stuff was there. They discounted services. So and then as I sat stagnant, and my executive director Teo can remember these stories, I would call and say, um, "It's COVID, and yeah, I have some stuff to do, but I don't have lots to do, and I'd like to be able to work on this for this particular family." And they were great. They're like, "Go for it. Use that resourcefulness that you can share and utilize." And so I found myself in contact with the case manager at Dartmouth and started to help orchestrate things like, so they discharged her. 5 days later, she was scheduled at Dartmouth to do follow-up appointments. She, she was non-weight bearing. And so I would say things like, well, how is she supposed to do that? What are you going to do? Well, she'll have to come by ambulance. Okay, then what happens when she gets to the door because you won't let anyone else in? Do you have someone who's going to be able to take care of her as she waits from this appointment to x-ray to that appointment? It was really interesting to sort of see how the inner workings went, but we figured it out. They allowed her daughter to go in and stay with her. They consolidated the appointment, so she wasn't there as long. But again, and it reached out to the VNH to figure out what was happening with PT and OT and things that she needed to have. Now she's home and she's not going to a facility. So it just spun. What do you need? What else do you need? How else can we help?
So at the point in which, Beth Robinson friend kind of, obviously came into the picture and things like that versus Beth Robinson, Grants, manager for OHF, so in how essentially in a time frame from when you came in within your professional role within Anna's life, how much time had essentially passed from when you started helping put together this plan of action to help get the ball rolling at home and make sure things are set up and placed for Anna, roughly how many days had you started working on this prior to discharge? And then obviously I know you helped work with her after discharge, but so if she was at the hospital for 11 days, on what day did OHF essentially start helping with this?
So I think she'd been there maybe a week because nobody really had any idea when she was going home. And I don't think, the family knew. So, on the small scale, we were trying to figure out meals and, did her husband need anything? And was the house ready? Like things we knew would eventually need to happen. And then once we knew she was being discharged, there was some jumping through hoops because I wasn't listed as someone, that was privy to her medical information. And so I spent time in the evenings talking to her daughter, trying to coach her along the questions she needed to ask and how to be an advocate for her mom. And so that's how it started. And then as we knew when she was being discharged, just in my role here, what equipment is she going to need? Is her insurance going to cover that? Okay, it's not. Okay, now we'll find who we're going to get this stuff from, and we're going to get some of this in order because you can't send her home to no hospital bed and not the things that she needs. So and then after she came home, then there were those conversations. Now I am someone who can talk to them about her care. We've established the finance applications filled out. Her daughter was doing that and her sister, and the financials, they qualified for a grant. All those things were happening. And then I had, what I needed because I could get the prescriptions. I could talk to the folks at Dartmouth. I could talk to the folks at Keene Medical. I could ask them to discount it. And they said yes. So then I feel, and from a really big family, I'm one of 12 children. I feel like this role is ideal for me because I love people. I love doing things for people. And even though I said she's one of my dearest friends, I mean, I will go to lengths, maybe more so than someone else, just because I think this little thing could really help somebody out. And this wasn't a little thing. This was a big thing. And I really appreciated, like I said, the foundation supporting me and doing these things for Anna. So I certainly had, my work hat on, but my heart was in it as well.
And I think it should go without saying, but I want to make sure that I say it, that yes, this story in particular within OHF is, somebody that you had a previous relationship with, friendship with, and things like that. But I personally know that this is the way that Beth interacts with everybody that she's providing supports to, and that it doesn't matter if she's known you for a million years or she just met you yesterday. This is the time and effort and energy that you put in to help Anna get her set up and things like that would have been the exact same for somebody else who also needed the same setup and support that Anna did. And I think that is one of the biggest pieces of just OHF in general, is that it's to support the communities that are within the catchment area for OHF. And it doesn't matter who it is, the same type of support is going to go across the board.
Right. All of everybody that knows Beth thinks that she's perfect in her role at the Ottauquechee Health Foundation, because it's true. It doesn't matter if she knows you or not. She's gonna get things done. And even if they weren't able, the Health Foundation wasn't able to help us with a particular need, they at least were able to point us in the direction we had to go to get what we needed at the time. And it changed throughout my recovery. It changed from when I was in the hospital, the needs I needed there to prepare to come home, to after I was there helping set up the visiting nurses that came in, my physical therapy person. I couldn't get an actual, I didn't have an actual nurse. My sister ended up doing that stuff. But my physical therapist that came through the Health Foundation, VNH, visiting nurses, and then my occupational therapist that came, that they helped set up for me. It was huge help to learn how to move and get from, the bed to the chair, to the commode, to a couch for the first time, to, a recliner that unfortunately was a little too low to come back out of. The, slide boards are great if anybody needs one. They're an awesome invention, but whoever did it. But, excuse me. What you need, the needs change as you're recovering, and she was just always there. After one particular surgery, I bought myself a scooter because I couldn't put weight on my right leg, and Beth she found out I did it. She's like, "What are you doing? We could have done that. Why didn't you ask?" And it never, it never dawned on me to ask for help with any of that stuff. So, for those of you out there that have questions, ask, before you jump, because, she may be able to help, and it would have been nice. So, but there are different needs at different times, and it's a huge help for the home health care grant that they were able to provide. That was split between my daughter and my sister was awesome, and just always being there was a very, it didn't feel so alone, which was nice.
Yeah, no, absolutely. And again, Anna, I'm glad to hear that, that things are going well, and you continue to progress, and given that you're upstairs, I believe, at the Ottauquechee Health Foundation right now, the fact that you could get upstairs is pretty impressive. So
yeah, that was a while.
and I think and I think, your story is one that really exemplifies what OHF can do. I mean, obviously there are going to be cases not as involved that don't require as many moving pieces and things like that. But OHF runs the gambit, and Beth, obviously, feel free to chime in and add in. But it doesn't matter if it's something very simple that one, maybe two phone calls takes care of, or something very complicated where it's talking to insurances and Keen Medical and hospitals and family members and all of these different things where just hours and hours are going into providing the support. That's what OHF is here for, and is to be able to provide that care that is needed for the individual at whatever stage that may look. And Beth, we've got a few more minutes here, and just please please feel free to chime in with any of that and add anything you'd like.
I was just thinking as we wind down, the word of mouth is wonderful. We're on social media, and we try to keep up to date, keep people, help them be aware of, the Veggie Van Goes and the things that are going on in the community, in the greater communities. Community connections, it's probably one of my favorite things. I love if I get a grant request. I might know that, we've got the funding, and I know my grants committee, and I say, yeah, we can take care of this. But then I say, why should we pay for all of it? I have an idea. I'm going to call Senior Solutions. I'm going to call another local organization, and let's do a group effort. Let's pool our resources and still get the person the thing that they need, but let others get involved as well. And that's a really those community connections, the referrals coming in from the providers. That's amazing. It's great. We do. We had a gentleman a couple of weeks ago, hot weather, lives alone, really low income. And there was something wrong with his well, and he was told that he couldn't drink the water. And so a family member called the social worker at the Ottauquechee Health Center, it's part of Mount Scottney. And they called and said, what can we do? And I said, well, water is a basic need, absolute basic need. So one of us went over to the grocery store. He was someone we helped before, so we knew, where his income, was, and just brought him several gallons of water, and then had an order placed so that he had enough water to get himself by until they could figure out what was going on. And then lovely, the aging in his community, that organization, somebody came over, they figured out what was going on, they got the water problem figured out, and so it was a real, between the family member, Ottauquechee Health Foundation, Ottauquechee Health Center, and then the community, it was a really nice, you think, I don't have water. Well, it was a really big deal for someone who couldn't afford to go and buy that for himself or have the transportation to get there. So it was, awesome. Those are the things I like most about my job.
Perfect. So, and then obviously the other big piece that, for, those in the community that maybe want to be able to help support, how would somebody be able to, donate to the Ottauquechee Health Foundation? What are the methods for being able to do that?
So we have a couple of annual appeals that we send out, one in the spring, and one in the fall. It comes with a little return envelope. But you don't have to wait till then. Anyone can send a check to the Ottauquechee Health Foundation. You can earmark it for just good neighbor grants, just a particular community. That's a wonderful way to do that. Often we ask folks to just be our ambassadors. If you've had an experience where, we're someone that you support, why you support, talk to other people about it. Not always easy for someone on the receiving end to say, oh, Ottauquechee Health Foundation helped me. So Anna, thank you so much.
I'm sorry I was saying this.
That's a little bit difficult for us. And sometimes, we have fundraising events, and of course that would be an opportunity to donate. Always looking for membership, looking for board members if you want to, if you don't have maybe the financial backing to be that sort of a donor, donate your time. Yeah.
And so the website for the Ottauquechee Health Foundation is ohfvt.org. Is that correct?
Correct.
And so on the website, I assume, and I've perused it a couple of times, but there's information, more information about the foundation, board members, things like that. I assume there's also a place to be able to donate through the website as well, if people wanted to do that.
Absolutely. You can find our applications there.
Awesome.
As well, and download them and have them right there. You have all our contact information.
Perfect. Yeah. So
what we're up to, what we've been up to.
Perfect. Yeah. So check out the website. I assume there's also links to all your social media feeds there as well. And so we've gone over a little bit, but this has been an amazing conversation. And Beth, again, thank you so much for providing this presentation, and Anna, thank you so much for telling your story and how the Ottauquechee Health Center has. Our Ottauquechee Health Foundation has OHF has been able to provide supports for you and show us some real world application of how the whole process worked. So I want to thank you both, and I want to thank everybody who watched live during this presentation, as well as anybody who is watching on YouTube on demand moving forward. We'll be back next month with another presentation through the Let's Talk series presented by the Visiting Nurse in Hospice for Vermont and New Hampshire. Thank you all.
Thank you for giving us the opportunity, Anthony. Thank you so much.
You're very welcome.
It's a pleasure.